Thank the gentleman from Indiana for yielding. And Mr. Chairman, in Arkansas, my district, we grow world record watermelons. I heard a story about a watermelon farmer who had a bad business model. It cost him $4 to grow and get his melons to market, and he was only selling them for $3. So he hired a DC consultant to solve his problem. The consultant's recommendation was that he just needed to get a bigger truck. Mr. Chairman, this amendment is not a solution to help children, seniors, or people with disabilities. It's simply a bigger truck for a bad business model. I think the gentleman from New Jersey mentioned 7 million people. I think the actual number of people receiving health care funded through Medicaid is closer to 11 or 12 million people across the country. The current Medicaid program is broken. Its costs are rising out of control, and ultimately American taxpayers are paying for it, whether it's state tax dollars out of one pocket or federal tax dollars out of the other pocket. We need a cost-effective Medicaid system that is sustainable and meets the needs of our most vulnerable children, seniors, and people with disabilities. I served in the state legislature where Medicaid was our single largest expenditure, exceeding what we spent on K-12 and higher education combined. The current system actually encourages higher spending because of the limitless, uncapped supply of federal money. The more states spend, the more they get back from the federal government, with a minimum 1-to-1 match and up to nearly 2.5 times federal match for every state dollar that's spent in a lot of states, including my own. Our states have real solutions for Medicaid, but their hands are tied in implementing them. We need to untie the hands of our states and send their federal tax dollars back without CMS's strings attached and give them flexibility to solve their problems. My state, along with many others, wants this flexibility and will accept caps for that flexibility. This amendment does just the opposite and would only grow a broken program, making it less effective and ultimately diminish Medicaid-funded services for children, seniors, and people with disabilities. We need innovative thinking and real solutions as outlined in the budget resolution. We can't continue the old, tired ideas of throwing more money at a problem, especially when it's borrowed money. I encourage defeat of this amendment so that children, seniors, and people with disabilities, and ultimately the American taxpayer can win. And I yield back.